So we're going to be doing head, face, neck today. You'll see that I'm making sure that hand hygiene is key during every time that you see patients, not just during this current time frame. This is my patient Jill. I'm Wendy. It's nice to see you all. Hope you're having a beautiful day. But here's head, face, neck. You're going to do the normal that we talk about in every lab. Hi, my name's Wendy. I'm your nurse. My name is Jill. I know we're not supposed to handshake, right? Are we supposed to do this?
We're supposed to do this right now.
Oh, well,
That's okay.
Life moves on.
It does.
Okay. But I've hand hygiened.
Us nurses have been through every virus.
Exactly. We lived through it.
We did.
Yes. So, hand, face, neck. So today I'm going to be doing a hand, face, neck examination on you. You can go through your health history questions with your lab instructor. We will be working with you on those as we Zoom with you throughout the semester. But I'm going to show you the exam today. So the first thing I'm going to do is ask her if she's alert and oriented times 4. So the various questions. Can you tell me what day of the week it is?
Sunday.
Can you tell me where you are?
I'm at Cal State Long Beach.
In quarantine.
In quarantine.
And can you tell me your name?
My name is Professor Ross.
Okay. And can you tell me who the current president is?
I would rather not.
Okay. All right. Is it George Washington?
It is President Trump.
It is President Trump.
Yes.
Okay. All right. So I'm going to go ahead and get started. Again, hand hygiene, patient is alert and oriented times 4. If you're in my lab, you know that I've already done cap refill times 3 as I was shaking her hand and going through each of her nails. And so she has cap refill less than 3 seconds equal bilaterally. Okay. So I'm going to just start with your head. Can you please take your hair out for me?
Sure.
I'm going to start by inspecting and palpating her skull for any deformities or any differences. Let me know if anything hurts or is tender. You really want to get into the hair. You want to make sure that you're palpating and looking for any nodules. Everything seems good. Also, if you're in my lab, you know that I love for infestations of lice. And so you're looking at the nape of the neck to double check that there's infestations of lice, and there is not.
No nits.
No nits today.
Awesome.
Maybe tomorrow, but not today.
Awesome.
Awesome. And then I'm going to also feel your temporal arteries. So you're going to just feel me palpate those. You can do these at the same time. It's unlike carotid arteries where you don't want to palpate them at the same time. And they are +1, equal bilaterally. And then you're going to also palpate the TMJ. So you're just going to move down and go right to the joint here. If you can open and close, great. And there's no clicking. It is smooth movement. Any pain or tenderness with that?
No.
Great. Thank you very much. So the next thing that I'm going to do is palpate her thyroid. It's really important. Oh, I'm sorry. I have to inspect the face first. I'm sorry. I jumped ahead on you. So I'm going to inspect your face. She is symmetrical, equal bilaterally. Her nose is center. Her eyes are approximate equal distance from each other. Her ears, I'm going to look and give the angle, are approximately at the angle necessary for this. We want to look, there's a slight angle upward when we're looking at that, but they are equal bilaterally. I don't see any open lesions or wounds. She does have scattered macules, if you remember from skin, scattered macules, freckles. Her eyebrows are equal bilaterally. And I'm just double checking that I don't need you to do anything, but you're appropriate and calm and all of those fun things. I'm going to tap on your sinuses. I'm going to tap on your frontal sinuses, your maxillary sinuses. Any pain, tenderness here?
No.
Okay. You can just do pressure this way. You can also do the tapping method that I just showed you. Either is acceptable in the sphenoid. Sinuses are right here near the temporal artery, so any pain or tenderness there. Great. I'm also going to palpate your salivary glands. So you have the parotid gland here. Any pain, tenderness here?
Nope.
No. And then the other gland is the submandibular gland is right here, and then the sublingual is right at the base of the chin. Any pain, tenderness on those? Wonderful. Okay. Then we're going to do the...
Making sure we're not forgetting anything. We know how you guys are.
We want to make sure. I always forget something. My class knows I always forget something. But we're going to do all the lymph nodes. The lymph nodes, we do want you to be able to state them during any competency that you're going to be doing. We want you to be able to state them. So please make sure that you look at this cheat sheet that is posted for you. Okay? Each lab should have that posted for you so that you can look at that while you're doing this. So you're going to palpate both at the same time. So it's pre-auricular, post-auricular, Occipital's all the way in the back at that nape of the neck. Any pain or tenderness there?
No.
Great. I'm really big on continuation of hands so that we're not slapping the patient's face. Submandibular, and submental. I did forget tonsillar, which are right here. You want to do, the cervical are my weakness, people. You do the supracervical chain here. The posterior cervical chain is behind the neck area, and then subclavicular. If you can lift up and go right into the edge of those clavicles. Great. Go ahead and relax. Wonderful.
I've never felt one of these, but if you do, it's a bad sign. It's usually an indication that there could be lung cancer.
Yes. Or breast cancer.
Or breast cancer, yeah.
Yes. The other thing is we're also going to test the range of motion of her neck. So I'm going to have you, if you can put your one ear to your shoulder, one ear to your other shoulder. If you can look up, and if you can look down. The thing that we no longer do is can you do the big circular thing with your neck? Because I found that students tend to roll their neck really hard and have fun with it. So we're just not going to do that today. And then if you can turn your neck this way and look towards your shoulder, and again the other way. Great. Now you're going to do that with resistance. If you can please push against my hand and push against my hand, push against my hand and push against my hand. Can you please shrug your shoulders up and down and then against resistance? Great. And down. And you want them to be equal bilaterally. The last thing that we're going to do is the thyroid. You always want to do the thyroid from the back. So you want to go behind the patient to do this. You want to let them know, I'm going to be assessing your thyroid, so I'm going to be coming around your neck. That way, if they have a history of any trauma that you are not aware of, you are warning them that you're going to be holding them by the neck. There's a difference. You do not want to grab them, right, so that they feel like they're being strangled, but you do want to gently place your hands calmly on either side. So again, I'm not holding her neck solidly. My thumbs are up in the back, so I'm just right at the occipital area of her neck. So if you can press the thyroid, you're going to palpate the thyroid at the trachea area. It is a butterfly shape organ. You're going to just push the thyroid over to one side and have the patient swallow. You're feeling for an up and down movement.
You can't swallow.
She's not swallowing.
You're pushing too hard. You're pushing too hard.
I am not. And then go ahead and swallow again for me. And you're feeling an up and downward movement, okay? And then the last thing that you want to do is go ahead and auscultate that brewery. The best way to auscultate for a brewery is, again, using what is this called? The bell of your stethoscope.
Sounds like you're saying brewery, not brewery.
It's brewery. I know, my students tell me that all the time. The best way to auscultate for a brewery is you just want to place this, pretend my ears are in my head already, and you're just going to have the patient turn their neck slightly. She did that for me. I'm listening for 5 to 10 seconds, and then if you can please go to the other side, and I'm also auscultating on this way. Okay? And that concludes head, face, neck. Thank you very much for your patience. Bye.
Bye.